Hello and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today we are going to talk about keeping you healthy this winter, or at least keeping you from getting the flu. My guest is Kim Matera from the Health Department. Welcome, Kim.
Good morning.
Let's start by talking about what the flu is, because I hear people all the time saying, oh, I had the flu, and they're out of work for a day or two. That's not the flu, right?
Correct, that is not the flu. So the flu is actually a viral infection, and the flu can take on similar symptoms from a common cold,
right,
but it is not the same symptoms. So once you have the flu, you know you have it. You know the difference between the flu and the common cold. So the flu will definitely have abrupt onset of symptoms, meaning one day, Monday, you're fine. Tuesday, you're in the bed, you're sick as a dog. And some of the symptoms could be severe fever, high fever, not low-grade fever, which you will have with the common cold.
So like what's the difference, like 99?
So low-grade fever would be like 99.9,
okay.
101, 100.1. That's low-grade fever. And you will happen to have those with the common cold. Mm-hmm. But the fever, you will have 100, 104, 105, and you will definitely have the fever, the chills, the night sweats with that. And that would take about 3 to 4 days on your system. And then you would be in the bed. You cannot go to work with the flu. Mm-hmm. Those symptoms, you just cannot function. You just have to lay down and rest.
And when people get a stomach virus, that is really not the flu, correct?
Not the flu. So the stomach virus, most symptoms are nausea, vomiting, low appetite. Not the flu, but some people will always say, because it's flu season,
right,
it's the flu.
It's the flu.
No, not at all.
When you get the flu, you really, really know it.
You really know it because you have those, not necessarily the soreness that you have from working out, body aches to the point where it hurts to turn in the bed. It hurts to even move your arm up to raise it to get a glass of water. Those are the symptoms of the flu. So like I said, once you have the flu and you've had it in the past, you will know the difference between the flu and the common cold.
Yes, this is why I get a flu shot every year. I had the flu one, and it takes a long time to get over.
A long time, yes.
There are things you can now take that may make it a little milder or shorten its course, but you can't, heal it. It's not the same thing as a bacterial infection that responds
Correct.
to an antibiotic. You might go to the doctor and beg for one, but even if they give it to you, it wouldn't help.
Correct. And sometimes doctors do, just to appease the patient, to give them antibiotics, and that's really not what you want. Viral infections, the only type of treatment is antiviral medication, and you treat the symptoms. Mm-hmm. That's it. Antibiotics will not help for a viral infection like the flu.
So for most of us, we get the flu, we're out of work for a week probably,
Correct.
Depending on exactly, when it hits and when the weekend is and stuff. We feel miserable, but we recover. But there are people who are more vulnerable and experience more problems or complications. Who are those most at risk people?
So most at risk are our young children because they don't have much immunity. Our older individuals, 65 and older, because they're just older and they have other comorbidities at that age. Mm-hmm. And people who already have compromised immunosystems, like HIV, our AIDS patients, our diabetics, mm-hmm. Our people with congestive heart failure, our people on renal dialysis, people like that.
So basically, if you have anything that makes you a little more fragile, like I have asthma, kinds of things like that,
yes.
They always tell me, but you have to watch that because people don't remember that diseases like the flu can still be fatal. And they can.
Yes, most certainly. And, influenza is the leading cause of death from a vaccine-preventable disease in the United States.
In the United States, I was going to say, I think
in the United States.
Wow.
Yes. So getting the flu shot can actually, from the 2013-2014 data on the CDC website, the flu shot, influenza shot, has actually prevented 90,000 hospitalizations, has prevented 3.1 million medical visits, and 7.1 million illnesses from getting the flu vaccine.
Well, and you think about I hadn't really thought about the cost, but the cost of going to the doctor, the cost of going to the hospital is through the roof. The cost of missing 5 days work is
Correct.
a lot. I mean, there are a lot of people who don't have paid sick leave, or who are out of paid sick leave, or who are taking care of young children, or old people who, can't really afford that time off.
Correct. And most people don't think in terms of those, especially for our women who are taking care of younger children. They take off because their children are sick. But when they get sick, they have no more time left.
Right.
So they have to use whatever they can, scrounge up whatever they can. And those patients are almost forced to go to work sick. And that's what you don't want when you have the flu. You
right.
definitely
Then you
don't
run
want to
yourself down, and you run a bigger risk of complications.
Complications, and then infecting other people.
Yeah, and that's what, you don't want, is to infect the children or the older folks, or anybody who has a compromised immune system. And there's a lot of people on, people with cancer, people with all kinds of diseases that are susceptible. Okay, so we know it's preventable.
Yes.
What do we have to do, Kim? Tell us.
Get the shot. You can, for one, get the shot. And the shot is available around October each year. That's the time when most health departments, clinics, doctor offices have it at that time. And you can get it all the way from October all the way up to May, June. Because the flu shot will expire the end of June, so you can get it all the way up to then. But we always want our patients or our community to be informed to get it as soon as the doctor or health department has it in stock.
Because it takes a little while for it to be effective, right?
Yes.
It's got to be in my system to kick up the antibodies or whatever.
So it's called protective immunity.
Okay.
And it takes about 1 to 2 weeks to build up that protective immunity. So that's why we always suggest you get it earlier in the season than later, because the peak time to get the flu is January, February, March.
But it varies year to year. I mean, every flu season is a little different. Sometimes it starts a little sooner. I mean, you just really don't know.
You don't know, and medicine is a science, so it's best practice. And Mother Nature, we really can't figure out Mother Nature, so you just have to be prepared.
So why do some people not get the flu shot?
Well, there's a lot of theories on that, and so a few reasons why some people will not get the flu shot, and that is fine. It's their right, their choice, but we always want them to be educated as to why some of the misconceptions, like I received the flu shot and I got the flu.
I hear that all the time. I'm like,
Yes.
really? Because I get it every year. Never happens to me.
Not me either, but only 1% of the population will develop flu-like symptoms, like mild flu, mild muscle soreness, and that's just a side effect of the flu shot, not the flu at all.
And I think that gets back to people don't know what the flu is.
Yes.
Once
Yes.
they've had it, they don't say that anymore. But there are a lot of
Correct.
people who feel like they're young and healthy and it isn't a necessity for them.
No, so you can have the most robust immune system out there, and you will still, if you are exposed, you will still get the flu. And you will still take time to recover like everyone else who has gotten the flu. But you want to be able to, let's not be reactive, but proactive and just get the flu shot.
Well, and the other thing is, like right now we've spoken primarily from an individual's point of view. So I, as an individual, can make my choice of what I think is best for me. But remember that we live in a society and a community, and the health department looks at the health of the community.
Correct.
And so if someone doesn't get it, they're at more risk of spreading it to people maybe who are more vulnerable.
Correct. And also, we were talking about this earlier, people confuse signs and symptoms of just a regular respiratory infection. Respiratory infections always happen come the winter, the fall time.
Oh my gosh, yes.
They consider it
from
the fall.
allergy season through the winter when we're all indoors and the air I mean, I get one or two every year, but it's not the flu.
No, but they think it, and then, I had the flu this season, so I don't need the flu shot. Oh, no, you did not have the flu this season. You just had the common cold. And then, lastly, sometimes they may get infected with the flu, but it's not the strain that the flu shot covered.
Or you get it less severely because you have some partial immunities. If you've had the shot and you still get the flu, it at least maybe isn't quite as bad.
Yes.
Okay, how do we get a shot? And I feel even funny asking this because frankly, it is so widely available now. Like every drugstore, your doctor, I mean, it's really easy to get a flu shot for most people.
Easy. It's very easy. I think the fear is cost associated with it. Health departments have free flu shots. It's best to get it in the beginning of the season where the supply is.
There are years when the flu hits early where the vaccine runs out because more people go and get it once they see.
Yes. Walgreens, Rite Aid, they have the flu shot. Your doctor's office, and that's another reason why some people don't get the flu shot is because there's a wait list for their doctor's office. It's like a 3-month. You call your doctor, you can't get in there for another 1 to 2 months.
Really?
Yes.
Oh my gosh.
Because people are sick. And people get sick. So you don't want that to be a deterrent. So that's why you come down to the health department.
So can anyone do that or is that income qualified, Kim?
Anyone with insurance, no insurance, low insurance. We just want to get our community healthy.
So you'll get the reimbursement that you can and the rest is comp. That's great.
Yes.
So how can people get that information about what times you give shots or if they need to? They don't need to make an appointment, right?
No,
They
walk
just
in.
Walk in.
Walk in. And it's walk in Monday through Friday. You can get it from 8 to 11 or 1 and 2, between 1 and 3, Monday through Friday at the Hampton Health Department. Now, I can't say here about everyone else.
If they live in another locality, they should call first and check the hours.
Correct. They should call first, yes.
Okay. Anything else we need to add about this before we close?
Anything else?
Just, it changes every year. That's the other thing I think. Some people are like, I got it last year, don't need another one.
Well, you definitely need one yearly, annually, because the flu shot, you will wane your antibiotics, basically meaning it's highest the beginning of the season, and the antibiotic effect will wane down, will lessen come the end of the season. So
and the flu changes.
The flu changes, yes, it does. So the viral strain changes. So the shot that you got last year may not be the same shot you get this year.
It's complicated, isn't it?
It is. It is, and trying to explain it so that we can be better informed and educated about it. It's kind of complicated as well, but hopefully I was able to explain it.
I think so. Okay, thank you so much. And if people have more questions, they should contact the health department or their physician or their pharmacy because they do, I mean, it's very easy. The access is everywhere now. It didn't used to be.
No, access is everywhere. Information is everywhere. CDC.gov, the Hampton Health Department, like you said, the doctor's office, your local pharmacy, it's everywhere.
Okay, thank you, Kim.
You're welcome.
And thank you for watching. Realize that it is better for you, better for those around you, and really think about getting that flu shot. I get it every year. It hurts for a second, and you're done, and you can get through this winter without quite as many worries. Thanks for watching.